Hello, my name is GailD, and I am participating in the University of Texas El Paso Masters in Nursing Education program. Today I'm going to conduct an advanced assessment, and Mr. D has graciously agreed to be my subject patient. I've already completed the interview section of the assessment. We discussed his past medical history, his family history, his social and personal history, his sexual activity, and during that time I also conducted my mental status exam and determined that he was dressed appropriately for the climate, his responses were appropriate, his behaviors were appropriate, and his speech was appropriate. I also asked him if he had any medical issues that he wanted to discuss and any questions that he had to ask. And I completed the interview portion by taking his vital signs, so I know his blood pressure, his heart rate, his respiration rate, and his pulse oximetry, and his temperature. And now we are going to start our physical exam portion of the assessment. First of all, I'm going to inspect his head and neck. His head is in the proper position. His head, he does have even hair distribution, and his eyes are symmetrical, his ears are symmetrical, and now I'm going to palpate his scalp for any lesions or nodules. I don't feel any. I'm going to check for his lymph nodes, no enlargement there. I'm going to ask him to rotate his neck from side to side to check for range of motion, in front and back. Excellent. Any pain or discomfort with that?
No.
Excellent. So now I am going to auscultate his temporal arteries using the bell of my stethoscope. And now I'm going to auscultate his carotid arteries. No abnormalities there. I was listening for bruits and I hear none. And now I'm going to check his eyes. They're symmetrical. His eyeball distribution is even. I'm going to check the conjunctiva. I don't see any abnormal drainage. I'm going to palpate his lacrimal glands. Nothing there. I'm going to palpate sinuses. Any tenderness there?
No.
And then I'm going to ask him to put on his glasses and do an eye test for me. If you would please stand up, Mr. D. We are 10 feet away from the Snellen chart. He's going to put on his glasses. And can you read the bottom line?
ORZSK.
Thank you very much. That's 20/20 vision with corrective lenses. And now we're going to check some cranial nerves. So I'm going to wiggle my fingers, and I want you to tell me which side you see wiggling.
Left, left, right, left.
Excellent. Can you close your eyes really tight for me? And now open them real wide. Really wide, lifting up your eyebrows and wrinkling your forehead. Excellent. Can you puff out your cheeks? Excellent. I'm going to check and see if you can feel sharpness and dullness. So this is the sharp end, this is the dull end, and I'm going to check your forehead, your cheek, and your jaw. And tell me if it's sharp or dull.
Sharp, sharp, dull, sharp, dull, sharp, 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 dull, sharp, dull.
Excellent. If I had an ophthalmoscope at this point, I would also check his retina and I'd be checking for the red reflex, I'd be checking for the blood vessels and vascular structure. I would be checking the fungus, the optic disc, and also the macula, using an ophthalmoscope, which unfortunately I was not able to get. Now I'm going to check his throat and nose. Throat first. Can you say ah for me? Get my light on. Big ah. And then I'm going to check his gag reflex.
Good. Good.
Present on both sides. Now, during our history, we did note that he had no tonsils, so there are no tonsils present. And then I'm also going to check the sides of his tongue. And both the sides look normal. All right, so now we're going to inspect the nose. The septum doesn't look deviated, and I'm going to just have you put your head back a little bit, and we're going to look in and see. See a little bit of swelling. Do you have allergies?
Yes.
And no mucus. Hair distribution is even. Looks good. And now I'm going to check for his ears. His ears are symmetrical on his head. They're even with his eyes, and I don't see any drainage noted out of either ear. Now we will check the membranes all look good. I'm pulling the pin up and back to expose the internal ear canal. I'm going to go ahead and palpate his thyroid gland. I don't feel any abnormalities there. I'm also going to check his tracheal alignment. That's all normal. And then I'm going to use a tuning fork, and we're going to do the Weber test and the Rhine test. The Weber test will be determining if he's got any unilateral hearing loss, and the Rhine test will check bone conduction and air conduction. Unfortunately, I've been having a hard time hitting this, so I may have to hit him on something else to get the sound.
Can't hear it.
Can't hear it. You hear it in both ears?
Yes.
Tell me when you stop hearing it.
Done.
Okay, we'll check the other ear.
Done. Done.
Excellent. So it should be equal in both ears, the amount of time for bone conduction and the amount of time for air conduction. All right, so now we've checked everything for his head and neck. We have a few more cranial nerves that we'll be testing. We're going to check his pupil reflex and then see if he can go through the 6 cardinal fields of gaze. So if you can look up. Keep your eye open and look straight ahead. His pupil is reactive and brisk. And then if you can keep your head straight and follow my light with just your eyes. Excellent. Very good. And can you open your mouth real wide and clench your teeth real tight? Clench your teeth. Clench. There we go. Okay. And can you swallow for me? One more time. Cough. And then we did on the gag already. Can you shrug your shoulders? Excellent. And can you stick out your tongue? And then stick it out and hold it out. We're looking for any tongue deviation at this point. Excellent. So now I'm going to move on to the chest and the lungs. You can put your tongue back in your mouth. Excuse me. I'm going to look at chest and lungs. His chest is symmetrical. He is breathing regularly. His rhythm is regular. His breathing is unlabored. I'm going to check for chest expansion. You can step forward just a little bit, please. And take a deep breath for me. His chest expands evenly. One more time. And now I'm going to check for fremitus. If you can say 99. Turn for me a little bit so I'm... Here we go. Say the phrase 99.
99.
Excellent. Even I can hear that or feel that evenly. Now turn back around, please. I'm going to check for crepitus. I don't feel any. And now I'm going to percuss for lung sounds. Sorry, I'm going to have you turn one more time. Examining table is a little more conducive for an examination. Okay. Go ahead and turn back on. I'm going to also take a deep breath from this. Okay, turn for me one more time. Thank you. You can turn back around, please. So his lung sounds and fields were all clear, no adventitious sounds, no crackles, no rhonchi. Everything sounded good. So now I'm going to listen to his heart and also check his pulses at this point. So I'm listening for the valve sounds and also checking his apical pulse. So I'm going to find the aortic valve in the second intercostal on the right side of the sternum, and then the pulmonic in the second intercostal, the tricuspid in the fourth intercostal on the left, and the mitral in the fifth intercostal mid-clavicular. And to check an apical pulse, we're going to listen for 1 minute. In the effort of time, we will move on. I'm going to go ahead and check his radial pulses. Nice and strong. Nice and strong. And at this point, I'll check his pedal pulses too. So now I'm going to ask Mr. D to come over here. Unfortunately, I don't have a higher table, so we'll use our ottoman and ask him to lay down so I can inspect his abdomen. So first of all, I'm just inspecting to see, I'm looking at the vascular structure, I'm looking at the structure of the abdomen itself. And then I'm going to auscultate the abdomen first. We don't want to palpate and get everything stirred up and then listen, because we'll get false readings. So I'm listening in all 4 quadrants for abdominal belly sounds. And then using the bell of my stethoscope, I'm going to auscultate for any bruits over the aortic and renal veins, the iliac, and the femoral. Sorry, get a little personal here. Sorry. No bruities. So now I'm going to percuss in all 4 quadrants. And then I'm going to percuss to find the borders of the liver. And now I'm going to do a light palpation for muscle tone. And to see if there's any tenderness. Do you have any tenderness in your belly?
No.
Now I'm going to palpate for the liver and the spleen. And now the spleen. That requires deep palpation to identify the liver and the spleen. Mr. Dunn has a history in his family of colon cancer. Both his father and his grandfather had colon cancer. So he is very good about seeing his gastroenterologist regularly to have colonoscopies, and he monitors his stools. He has no issues with stools at this point, no blood in his stools, and he also is having no trouble urinating. He is sexually active with one partner, so if he wasn't, we would have a conversation about that, but we don't need to. So now we're going to look at the musculoskeletal section and also the skin. So I'm going to inspect first. His shoulders are symmetrical, hips are symmetrical, his skin is intact, it is no abnormal bruising, no abrasions. He does have no abnormal pigmentation. He does have the balding head, and so he is more susceptible to sun damage, and he actually does see a dermatologist regularly to make sure that he's being assessed for skin cancer. The dermatologist is actually freezing some spots to prevent any skin cancer from occurring. And now, Mr. D, if I can ask you to please walk to the door and back. I just want to observe your gait. And so he's got a normal gait, swings his arms appropriately. See if you can come and stand right here and just face the door. And then if you can bend forward, I'm just going to be looking at your spine. And the spine is nice and even, no curvature. And he's bending fine at his hips. Okay, you can stand up now. We'll go ahead and assess range of motion now. Can you raise your hands over your head? Watch the fan. Can you put your arms out to the side? And now can you put your arms behind you? Great. Go ahead and rotate them around down this way. There we go. Excellent. All right, and you can have a seat now. And now I'm just going to check his muscle tone. Can you squeeze my fingers? Very good. Now can you push your arms out to the side? I just want to see that you can push against resistance, and now pull in. And same with your legs. Push out that way. Now push in. Good. Now push down like you're pushing on a gas pedal. And now pull your toes up towards the sky. Excellent. And now checking his joints. Can you raise your foot up? I just want to feel how your joint is responding. Excellent. And now this knee. And elbows, bend your elbow up against resistance. Excellent. And this one. Excellent. Can you spread your hands out real wide and make fists? Very good. And we'll go ahead and check reflexes now. Turn. And that concludes our physical assessment. I want to thank Mr. D for being our subject patient. And at this time, do you have any questions?
No.
Then we'll conclude.